some situation you can use the elastic. I have seen this available in Vietnam too through the website and internet, and you can use this elastic cord that you can retract the rubber band down and hold it there. In some short procedure you can even do that. Okay, and the second that we use is a traumatic plan. Okay, every pediatric dentist or the dentist who see children should have this. Actually, endodontists have used this for a long time, right? And this is very useful for the kids that can tolerate procedure, communicate well, because we will say that, okay, you can stop me anytime, okay? Your right hand is available here, I will look at it. If you want to stop me because, it's too much pressure, and then you can raise your hand, okay? If you can communicate well, she can be tolerated as a traumatic clamp for you, okay? So no need for local anesthetic injection. And can use for a short procedure, okay? Even a filling or the sealant. And another clamp, I haven't been aware of other brand yet, but in Thailand we have this soft clamp that, what we call the composition is a resin. It is a resin clamp that first invented for prevent the restoration damage for the tooth that already has some restoration done. Okay, so we modify it and put it to the kid for the molars. It's worked well, and the kids feel like because it's no sharp edge, and it's gentle but firm, but there's no other form. It's only one size, one shape. If it fits, it fits. Okay, and you wouldn't have to worry about the pain because it's not poking into the gum. Okay, and it's autoclavable, but sure it can be distorted over time. Okay. Okay, and the other system that I would like to show it to you because it works well in our clinic. When you cannot isolate the tooth and you don't have to absolutely isolate it because you're not gonna mess with the pulp, okay? So you can do this type of isolation. This thing, comprised of mouthpiece, adapter, that is kind of used as a mouth prop, and also tongue and cheek guard, okay? And auto suction is patient friendly, okay? This is how it works. Oops, how can I make that number? Okay, you can voice it, fold it up. It's really soft. Okay, and insert it from the other side of the face and the mouth that you're not working on. Okay, and the kid can bite on this part as a bite block, and then it's right there, wall of the area that you're working with, okay? And this is how it works. Oops, sorry. Oops. Okay, I cannot show it, but I see it working. Okay, and the suction is built in. It's built-in suction, so you don't have to put any more suction in there. The suction is mouth prop, and it's also the rubber dam, although it's not an absolute isolation. It can have, retract the cheek and retract the tongue for you, okay? It's quite comfortable with the kid. Yeah, like that. And it will, have a suction built in. Okay. The other things that I mentioned before about resin infiltration, okay? You all might have known that resin infiltration can be, used for the proximal caries in the permanent tooth. And this is another thing that we find useful for the young permanent incisor with the kind of defective enamel. For the acquired defects like white spot lesion or maybe the porosity because of the imperfect enamel formation. That some kids, you can see in the photos here, she is 8 years old, okay? And she wants her tooth is more like the others, not so beautiful, but more like her friends. So what would you do? Okay, the study tells us that children do mind about their looks. Okay, and starting even in the school age. Okay. Some of them found it's not attractive to the opposite sex if they have some defects on the teeth. The study done so kind of artificial masking some teeth in the photos and compare these two with and without the defect, and found that the defect has diminished the attraction. And okay, and for the 16 years old, older enough, they say that they're not satisfied with their teeth. So what would you do if someone asks you at 8 years old that the white plaque, I don't like my front teeth? What would you say? You might say, nah, too soon to concern, just go study, okay? Or you would say like, oh, please wait until you're 16 and we'll fix it, okay? Or you want to say like, okay, let's try, okay? We'll help. This is a study about the resin infiltration. The concept of it is it used 15% the hydrochloric acid. It's pretty strong, and it will, etch the enamel around like 40 micron. Okay? And we use the resin infiltrate into the porosity that we made by the acid etching. Okay? And then to mask it, the hardness is improved. Okay, I better say so. Like the micro hardness was reduced by the caries or by the defect around 24%, but we can strengthen it with the resin around 70% strengthened. Okay, the resin infiltration technique, but the bad things about it is not opaque, so you cannot see it in the radiograph. Okay, the steps is quite easy. You do a polishing, but you need to wall off all the soft tissue, okay, and the other teeth too, because the hydrochloric acid is quite strong. Okay, you can do the guard, you can use the duct tape, to cover up the adjacent teeth. Okay, and for you use a 15% hydrochloric for 2 minutes. Okay, and then you rinse it off for 30 seconds. And you dry it with a 90% ethanol. It's come with the kit, the stuff that resin infiltration gave it to you for 5 seconds, and you can wait until it's like get into the porosity that you made for 30 seconds, and look at it. If the white plaque has gone away, and then you can proceed for the resin, okay? But if not, you can do the re-etching. Maybe more than around twice, you can do twice, you can do 3 times, or maximum at 4 times etching. Okay, you should not do exceed than 4 times, because it's gonna move away your enamel too much. Okay, but with this, and then you do a strip to make sure that one connected all the teeth together, and then you use a resin to apply for 3 minutes and cure it for 40 seconds. Okay, and then you do twice application of the resin and do the polishing. Okay, that's it. Okay, and this is the outcome. A few cases, and the last one is from the study from the fluorosis teeth, and they said that the colors are stable. Okay. There's like 1 year, 2 years follow up, and 6 year, or this one like 2 years follow up. Okay, the color stability is pretty good, and we need to improve the oral hygiene of the patients, and care just like you care for caries. Okay, and also there's a study that found that this really useful in the MIH, or molar incisor hypoplasia also. Instead of, we try to deal it with the glass ionomer or maybe some other resin, and we need to make cavitation, we don't have to. We use a resin infiltration in about the same way, and then you can get strengthened of the teeth. And it's found that the post-eruptive enamel breakdown, because it's resin, it split all the enamel together. The breakdown is less and significantly lower than use just only the fluoride products to strengthen the teeth. And the last one that I would like to mention is non-restorative treatment with the SDF, okay? There's a lot of people out there that study about the SDF because it's antibacterial and in the same time remineralizing effect because it's has fluoride. And no caries removal required, no caries removal is recommended. We just go by it the way it is. And it's simple, non-invasive, and inexpensive, and non-aerosol procedure. So we use that